Hello everyone, myself Vivek Devani and my topic is Milwaukee Brace.
Milwaukee Brace. So here you guys will be able to see the Milwaukee Brace. So the Milwaukee Brace, it was designed by Blount and Skimmett in Milwaukee in 1940s. Firstly, it was used for the post-operative cases after the surgeries, but nowadays it is generally used for the conservative management of the scoliosis. It basically has four different components. First is the pelvic mold or the girdle. Second is the head support unit. Third is one anterior and two posterior uprights, and fourth is the corrective pads. So now let's see each one of them one after the another. So first will be the pelvic mold or the girdle. So the pelvic mold or the girdle, it is made up of leathery or the plastic material, and it generally extends anteriorly from the 10th rib to the level above of the pubic symphysis or just below the anterior superior iliac spine. And posteriorly it extends from the 10th rib up to the as long as possible downside to the seat clearance. Next there will be the head support unit, which consists of a neck ring, one kidney shaped chin plate and one butterfly shaped occipital plate, and the uprights will be connected to the head support unit, one anteriorly and two posteriorly. So the next are the uprights. So the uprights which is one present in the anterior part. So it generally starts from the chin plate to the anterior superior iliac spine, and the two posterior generally starts from the paravertebral region and extends up to the anterior superior iliac spine. So the next will be the corrective pads. So first will be thoracic pad in the corrective pads. So it is located on the convex side of the thoracic curve and covers the least four ribs. It is connected by straps to anterior and posterior uprights, and it applies medial, superior and anterior directed force to the vertebral column through the ribs. It also limits the patient slump when fatigue, and it also provides a kinesthetic reminder to voluntarily move away from pad, thus reducing the curve. It also serves as a counter force to opposing pads, which are the auxiliary pads. So the next are the auxiliary pads. It generally covers the pectoral, axillary and the scapular areas. It provides a medial superior directed force which is opposite to the thoracic pads. It can retract, protract or elevate the shoulder girdle. It also improves the symmetry of the shoulder girdle. Next is the shoulder ring. It covers the pectoral, axillary and scapular and clavicle areas. It provides a medial and inferiorly directed force. It helps in retracting, protracting or depressing the shoulder girdle and improves the symmetry of the shoulder girdle. Next are the lumbar plate. It is used in lumbar curves, and it provides anterior and medial directed force to the lumbar spine, and it also assists the lumbar curves correction and deviation. So next are the kyphosis pads. It is generally used to correct the kyphosis, and it is located over the apex of the kyphosis and attached to the both posterior uprights. It generally provides anteriorly directed forces to the apex of kyphosic curves, and with sternal pad it helps in the voluntary extension of the upper thoracic and the cervical spines. Next there is presence of the sternal pad located anteriorly to the sternal notch. It encourages the voluntary extension of the upper thoracic and cervical spine, and it also relieves pressure at the chin plate. So there are some forces which are achieved for the correction. So first are the passive forces, in which there are two: the longitudinal distraction force and the anti-angulation deviation force. Next are the active forces, in which there are also two. The first is the muscular exertion to move away from the presence of appliance, and second is the exercise program with or without the appliance to maintain the muscle tone. So now the complications for the Milwaukee brace. So there is chance of deep sores from pressure on skin and on the bony prominences. Also there is chance of bite deformity due to pressure on the chin plate and mandible. It causes growth disturbances to the jaw on teeth. And there is also chance of exaggerated emotional disturbances and rejection of the brace. So now I will show you the Milwaukee brace, the real one. So, and I will also explain you the parts of it. So this is the Milwaukee brace. So here we can see the pelvic girdle unit, which is generally made up of plastic or the leathery material. Here you will be able to see the anterior one upright, and here are the posterior two uprights which are connected to the head support unit to the pelvic girdle, and here also head support unit to the pelvic girdle. Here you will be able to see the head support unit. Here you will be able to see the kidney shaped chin support, and at the back you will be able to see the butterfly shaped occiput support. So with this Milwaukee, also there is presence of some of the corrective pads, but here they are not present. So here one corrective pad is present over here. So with the Milwaukee brace, while wearing it, the patient can also do some of the exercises, and without wearing it, for scoliosis correction, patient can also do some of the exercises. So now I will show you briefly that which are the exercises we can perform with and without the Milwaukee brace.
So the exercises performed are pelvic tilt exercises with knee flexed and in progression with knee extension. The other exercises which can be performed are the standing pelvic tilt exercises with normal base of support with comfortable position. Other is the spine extension in prone position. And this all are the exercises which can be performed with and without a Milwaukee brace for scoliosis correction. There are many more other exercises such as push-ups with pelvic tilt and the active corrections for the spinal correction exercises which can be also performed. So my reference is a short textbook of processes and orthosis by R. China Thurai. Thank you all for listening me.